Today on The Real Story, COVID cases are ticking up, the Delta variant raising concerns, but Connecticut hospitals say they're prepared. This morning, we talk with Hartford HealthCare's president and CEO, Jeff Flaks, on the decision to mandate vaccines in healthcare employees and how the organization is trying to increase vaccinations in our state. Plus, former state senator George Logan is making a run for a seat in Congress. The Republican eyeing the 5th Congressional District, the seat currently held by second-term Congresswoman Jahana Hayes. What does he want to do for Connecticut in Congress? What are his priorities? We'll break it down with Mr. Logan himself. He is our guest this morning. It's all today on The Real Story. Good morning, and thanks for joining us on The Real Story. I'm Jen Bernstein. Connecticut's healthcare systems have transformed themselves over the last year and a half, having to make quick, life-altering decisions in an ever-changing environment as the COVID pandemic raged on. But we've been on the so-called other side of it. The mass vaccination sites have been closed, testing is down, and life is feeling more close to the normal that we all know. But we've all been warned that this pandemic isn't over. COVID cases are increasing, and we've seen some restriction rollbacks around the country. So how are our hospitals reacting to that? How concerned should we be? We want to catch up right now with the president and CEO of Hartford HealthCare, Jeffrey Flaks. Good morning to you.
Good morning, Jen.
So you all have known about the possibility of mutant strains. You all have talked about this before. How is the healthcare system preparing?
I think we're very well prepared. Across Connecticut, we're still working tightly with great coordination with the state of Connecticut, with the Department of Public Health, and all of our infrastructure is still well stood up. So I think we're very well situated. We continue to have significant amount of testing and surveillance. And today, Jen, we have 20 patients who are COVID positive within our hospitals. And the vast majority of the people who are within our hospitals are those individuals who have not been fully vaccinated. So again, I think we're well situated today, but it's something we're watching very carefully and ready to adjust in a moment's notice.
20 COVID patients currently in hospitals. Interesting. Okay, what about breakthrough cases? Are you seeing that tick up as well?
Limited numbers. There are examples of breakthrough cases, but the numbers I looked at most recently, the statistics I saw across Connecticut, were about the 2.1 million some odd people who were vaccinated. There were about 850 some odd breakthrough cases. So you're seeing very limited breakthrough cases throughout the entire horizon of this pandemic up to this point in time.
That is relieving to know for sure. Now, you all have the ability to scale up if need be. If we needed to do more testing all of a sudden, you have the infrastructure in place that you all created over the last year and a half. Are there any plans in the works to do that, or is it just a discussion of the possibility of having to create more test sites, et cetera?
Jen, we're ready. We never let our guard down. This pandemic is certainly not over by any means. We've been very attentive to keeping a high alert status in place and to have the agility to very quickly adjust, our capacity for testing, for vaccination, as well as hospitalizations accordingly. So, Jen, I'm so proud of our colleagues, the people across Hartford HealthCare. My 33,000 colleagues have been just heroic, and they stand ready to do this. But we're very, comfortable today where we're situated, and we're caring for people very safely. But we have to be prepared to adjust if it's necessary.
What are you hearing within the healthcare community about the possibility for booster shots?
It's a possibility, and we've been planning for several months so that we would be able to support the state as necessary with capabilities around booster shots. It's really not yet been determined to the extent that will be necessary, but we want to be careful and we want to be well prepared so that if it is something that comes to fruition, that again, our state can lead the way in terms of access, readiness, and the capacity to reach all of our citizens, as safely and as efficiently as possible.
Is there anything specifically that you would want to improve if you had to set up that booster shot clinic or reopen them that you did the first time that you feel like, you could improve on?
Well, we've learned so much, throughout this pandemic. Jen, I've said from the very beginning throughout the pandemic, everyone wants things to return to normal, and we all do in so many aspects of our lives. But in healthcare, we are already better than normal. And one of those ways is the way we're connecting within our communities. And, one example in Hartford HealthCare, we've built a mobile health company, and it's HHC Mobile Health now has vans that are every day operating throughout Connecticut. They're in churches, community centers, homeless shelters, prisons. We're popping up in different parking lots. This is an important thing that we have both the agility and the capacity to reach people and not expect people to come to where we are, but to bring our services to where they are. We have to meet every person where they are, and we have to ensure that nobody's left behind. So I think those lessons of how to do that were immensely important, and we are increasingly getting better and better at it. And this is never going to go away. Jen, this is, after this pandemic subsides, this is how we're going to be connecting for community health. It's how we're going to address the inequities in healthcare, and how we ensure that we can do a more effective job around prevention, around wellness, around management of chronic disease.
No, I mean, you're reaching an entire group of people that you might not have been able to reach before, providing health care for them. Hartford HealthCare made a controversial decision to mandate COVID-19 vaccines for employees. How is that going so far? Have you received a lot of pushback?
I think it's going well. We've already vaccinated several hundred more people who work within the organization just over the last several days. Today we have of our full-time colleagues, we have north of 82% of our people are vaccinated. So the vast majority of the people who work within the organization are vaccinated. And remember, Jen, we do have mechanisms in place for exemptions for religious purposes, and for people who have health conditions that would prevent them from being vaccinated. So, we have a process to respect, those individual circumstances that need to be recognized. But we're working hard, Jen, to communicate with every one of our colleagues one-to-one. We do it through large town hall meetings, through small work sessions, but also individual personal communications from our client, from our leading clinicians and scientists, to try to help people be as comfortable and as supported as they can, so that we can ensure that every person we care for within any one of our facilities across Connecticut, and that's more than 400 locations, knows that the people caring for them are as safely protected as they can be.
I know this is still an ongoing process. I was reading that people would need, or employees would need, to get their vaccine by the end of September. Is that still the time frame you're looking at?
That is.
Okay, so we have, go ahead, I'm sorry.
No, we expect to have our entire organization vaccinated and through that process by September 30.
Okay, so we have this 18 or 19% that are not vaccinated right now, and you're saying that there's a process that they can go through where exemptions can be accepted. How much of that percentage do you think falls into that category, or are we talking about a whole, 18 or even 15% of people who just don't want to get the vaccine?
I think it'll be a fairly small percentage of people. We have a lot of experience with this. We've been mandating flu vaccination for years across all of our facilities, and there is a small exemption process there also. So I think we do have some experience in how to manage that process. But we're hopeful, that through the outreach that we have in place, through the education that we have in place, through the access that we put in place, that we're going to successfully work and reach the vast majority of our colleagues at Hartford HealthCare as we reach that September 30 timeline.
So what happens if an employee refuses and just says, I don't want to do it, it's not happening? Are they going to go through the process of losing their job?
Before that happens, we're going to take every possible measure to connect with each individual. This has to be done so humanistically, in such a supportive manner. So we need to meet with each person, have discussions, have, again, education sessions, have them speak individually with clinical leaders, work with them on their own personal individual circumstances. And even then, there's processes around, certain mechanisms around suspension and so forth prior to what would eventually be a termination. So that is truly a last resort, and something we're going to work hard to ensure happens, with the rarest of circumstance.
Something to note that you all are doing, you are sponsoring a program with Hartford High students. I love this because it's creating a pipeline for people who are interested in the healthcare industry and exposing young people to potential careers, right? So tell us a little bit about what this program is.
Jen, I'm so excited about this. This is life-changing. This is going to change people's lives. We are partnering initially, and this is a pilot. We actually hope to expand it across the state in select cities. But this is with Ready CT. It's with the CBIA, and it's with the city of Hartford and the Hartford Public Schools. But in Hartford Public High School, for rising freshmen who are entering sophomore year, they can declare a major, in effect, to join the Hartford HealthCare Allied Health pathway, where we will have a special curriculum that we are co-designing. And these students will ultimately graduate with 3 certifications. So they'll be certified in first aid, they'll be certified medical assistants, they'll be certified clinical assistants. And they will have the capacity at the point of graduation to have already completed paid internships in our facilities. They'll have experience, they'll have certifications, they'll have very particular and meaningful education, and they'll be positioned to go on to 2-year colleges, 4-year colleges, or potentially directly into employment for organizations like ours. And to the extent that occurs, they'll be assigned mentors, they'll get tuition reimbursement, and we'll create pathways for continued growth and development across the allied health professions, from nursing to radiology and imaging professionals to laboratory technicians. We're going to build our workplace of the future. We're going to connect, to our enthusiastic, compassionate, empathetic high school students who want to join the front lines of healthcare and who've been inspired during this pandemic. And we're going to create, really very successful, highly supportive environments to give people really wonderful opportunity and grow in the workplace and really create advantages for people to mature and gain, what we think is going to be terrific employment and additional educational opportunities. So, I'd just say, Jen, lastly on this issue, education is a key determinant of social determinant of health, and we invest in education. We're founders of the Hartford Promise. We're investors in the Hartford Youth Scholars Program. And I think this is the next level, and we think it's an extraordinary program. And again, one we hope to see in other cities around the state, as we can demonstrate its value.
Yeah, it sounds fantastic. How many Hartford High students will be involved in this?
Initially, the cohort looks like 40 per class.
Wow.
So it'll be 40 sophomores, 40 juniors, 40 seniors as the matriculation advances. And, these are 40 human beings that we're going to create great opportunity for, really connect with, provide mentorship, advisement, those paid intern clinical experiences, and really get people, well-trained, well-prepared, on a path for advancement.
Yeah, and we know, obviously, education into the field is so important, the networking that comes with that as well. Look forward to hearing more about that. Jeffrey Flaks, thank you so much for joining us on The Real Story and catching us up on what's going on with you all.
Thank you, Jen. Thanks so much.
All right, ahead, it's official. Former Republican State Senator George Logan has launched a campaign for Congress. He's hoping to grab the votes of people in the 5th Congressional District. But it's not an easy path to victory in the 5th. How does he plan on courting voters, and what does he want to do for Connecticut if he goes to Washington? George Logan is on deck when The Real Story continues.